Let's talk about the nicotine, those treatment, the replacement.
The replacement.
What do we call those? Vape pens and the nicotine pens and patches.
Okay.
Does that work?
Very important. And you mentioned two things here. There's replacement therapy, and there is then all these commercial things that are now on the market. Replacement therapy stands for an adequate dosage of nicotine that is given to people to quit smoking or to help them quit the smoking.
Okay.
It's a pharmacologic treatment, and we use that as healthcare professionals. And that's different because that's regulated, that's measured, that's thought through a very thoughtful process that goes into a science and studies.
Okay.
That's one thing.
So you're giving the patient a little bit of nicotine?
Yes, in order to make them quit.
In order to make them quit.
Or to help them quit.
Right.
Because don't forget, nicotine is actually a drug. And it is a strong and potent drug that produces addiction. And sometimes, or even if you want to quit the drug usage, you have some specific physical damage that produces the lack of the drug. So we need to help sometimes.
Okay.
And this is used obviously in a controlled environment with a thoughtful process, as I said, and it can be prescribed to you. That's one thing. And those are regulated, and those are drugs that are regulated. Now, there is new commercial instruments that a tobacco company has placed there at the use of public will. And those are the e-cigarettes, the vapors producers, and many other brands that, of course, or different products that I don't even know because every day they come by with a new product.
Right, and they market you with different flavors and this.
Very difficult to regulate, very difficult to give particular damage control issues because every one of those contain as much nicotine as they want to. They're not regulated.